Good morning, this is your public health nurse. We'll be talking about lead poisoning today in children, also known as plumbism. We know that for a very long time now, for decades, the healthy people objectives have established standards. They've also observed the progress over time to achieve certain objectives, such as increasing public awareness and promoting the knowledge of the determinants of health, disease, disability, and opportunities for everybody. Now, what is lead poisoning, also known as plumbism? It is a clinical manifestation of lead toxicity. The clinical manifestation of lead toxicity. There is no blood level of lead that is safe for a child, for any child, because lead in the blood has the potential to damage some organs in a child's body. Organs such as the kidneys, the blood itself, and even the brain. Do you know that when the level of lead gets to a very high level in the blood, it can lead to coma in children, it can lead to seizures, according to Healthy People 2030. Now, children who live in older houses with lead-based pens are very likely to be exposed, to lead poisoning. That's something we need to know about. It's very, very important. Now, lead poisoning has negative effects on different organs of the body. It can have neurotoxic effects, which can cause encephalopathy, that's confusion, and nerve conduction problems in children. Hematotoxicity, which affects how iron binds with the blood and can lead to anemia in children. It also has cardiotoxic effects. Lead poisoning can also be gastrotoxic. So we have to understand that monitoring the blood level of children is very, very important. It's very, very important. And also obtaining emergency and immediate treatment for any child who has been detected to have lead poisoning is very, very important as well. According to the CDC, they teamed up with the Council of State and Territorial Epidemiologists to advance a national supervision system that monitors blood lead levels in the United States. This system oversees the monitoring blood lead levels in the United States. Now, even though there's a surveillance of lead poisoning in the country and data is available to see the prevalence and incidence of lead poisoning, it is not totally representative of the total population. That is not totally representative of the population. For instance, when you do a census, you count everybody, but the lead poisoning is just specific people and those who are tested. So there may be children who have lead poisoning, but they've not been tested or they are not even aware. Okay. Now, let's go to the next one. Now, for us to understand the agencies that give support to control lead poisoning, one of them is the state-based childhood lead poisoning prevention program, or the state-based adult blood lead poisoning epidemiology and surveillance program. This according to the CDC. So the public can rely on these programs for collection, management, reporting of data on lead poisoning. Now, with this surveillance, the good thing about it is that people who have lead poisoning in their blood receive appropriate follow-up and management of their condition because they are being monitored, which is a good thing. Now, according to the CDC 2024, it says it receives about 3 million lead test results each year. That's interesting. And when the reports are received, they're verified with the states to check for any errors before being analyzed and grouped into reportable surveillance format. CDC has information on the states according to states, total population and number of people, and the percentage of those who had lead poisoning. So CDC has information on the states. which is a very good thing. Now, we have to understand that there's a blood reference value that was recently lowered for lead poisoning. It has been lowered now from 5 micrograms per deciliter to 3.5 micrograms per deciliter by the CDC. So in the past, if you had a lead level of 3.5, you were okay. But now they've lowered the threshold so that when you have a 3.5 lead level, you're not okay. That means that's lead poisoning. Now, the CDC recommends that children who have a blood lead level at a limit or above the limit will be given priority medical attention for treatments. That's very important for us to know. Now, as nurses, registered nurses, and also for advanced practice registered nurses, we as registered nurses have an obligation to improve the health of the population that we serve by providing evidence-based care. All other providers and healthcare workers, such as registered nurses, like I mentioned, and doctors, public health workers, they have their various roles to play towards interventions for lead poisoning. Advocacy, educating the public, is the work of the public health nurse in primary prevention of lead poisoning for children of all ages and for the general population. So, the first step towards managing lead poisoning is finding the source of lead exposure, removing it, and ensuring that further exposure is averted. For instance, the age of the house where a child lives. It's important to ensure that buildings that are built or built before 1978 potentially dangerous for children because they have the lead pen that was used then is bad and it can lead to lead poisoning, okay, in children. So that's very important for us to know. So primary prevention, which is what we always advocate as public health nurses, because that is the first step towards disease prevention, is to ensure that children advocate, talk about it, teach, educate parents and people in the society, in the community, that children should not live in homes that are built around the 1940s and before 1948, as they have high levels of lead in the paints that were used then. Now, treatment for children with plumbism, which is also known as lead poisoning, is to follow the CDC guidelines. Okay? Follow the CDC guidelines. All right. So, children who, for instance, have been known to ingest lead poisoning should be considered for bowel decontamination, according to Daly et al. Secondary prevention and tertiary prevention are all necessary towards diagnosing and treating lead poisoning in children or in anybody for that matter. There's something you need to know, that the economic status of the family, sometimes, most of the time, is responsible for the exposure of the children to lead poisoning, because it's important for us as public health nurses to address social determinants of health for disease prevention in children and anybody. Because if these children live in homes that are built after 1978, at least more modern homes, with good amenities and all that, they would not be exposed to the pains, the lead that leads to lead poisoning. Now, children who live in economically disadvantaged neighborhoods with low income earners, people who live below poverty level, are more likely to live in such homes where they get exposed to lead poisoning. So that's something that is important for us to know. All right. Thank you. I hope you enjoyed my video.